Developing Evidence Selection Criteria, sponsored by the Canadian Partnership Against Cancer, and brought to you by the Capacity Enhancement Program. Once guideline questions are in place, the next important step is to develop criteria for selecting evidence to answer those questions. These criteria are used to decide exactly what evidence will be included and excluded in the literature search. So why do we need to decide beforehand exactly what we're looking for? Can't we just go to the literature and pick out everything that seems relevant to the guideline questions? Well, we could do that, but we would likely end up with an unmanageable amount of evidence to sort through. Ugh! Also, our decisions to include or exclude articles would not be transparent, and it would be very easy to let our biases influence our decisions. This would not be a very systematic process. A high-quality practice guideline needs explicit evidence selection criteria so that all decisions about including or excluding evidence are transparent and reproducible. That way, we can't pick and choose what we like best. All evidence that meets the criteria will be included. So, how do we develop evidence selection criteria? The place to start is the guideline questions. The population, interventions, comparisons, and setting in the selection criteria should match those in the questions. The evidence should also report on at least one of the outcomes of interest identified in the question. So, is it good enough to just specify the population, interventions, comparisons, outcomes, and setting in the selection criteria? Probably not. We'll likely still have to sort through a lot of evidence that's really not relevant or able to answer the guideline questions. There are a number of other things to think about to help refine the selection criteria. What about study design, study intent, study completion status, study quality, publication status, languages, and dates? Let's talk about some of these for a minute or two. We'll start with study design, or type of evidence. That's an important one. What is the type of evidence that will best answer the question? Some types of evidence are more useful for certain questions than others. Will synthesis documents such as practice guidelines or systematic reviews be used as evidence? If a type of study design can't answer the question, then there's no point in wasting time searching for it. Next, you need to consider publication status. Will the search be limited to published articles in medical journals? Or will unpublished data, such as abstracts from conference proceedings, also be included? What about study completion status? Should only completed studies be included? Or will early results from ongoing studies, or data from studies that were stopped early, be considered? Sometimes, a guideline development panel might decide to exclude evidence based on quality. For example, maybe only studies with a certain number of patients will be included, or only studies that are blinded or placebo-controlled, or those that score highly on quality assessment tools. If you don't have access to translation services, excluding evidence based on language is reasonable. It is also common to limit evidence selection to certain years of publication. Sometimes older literature may not answer a guideline question because of differences in standards of care or availability of care options. In conclusion, it's important for guideline developers to decide on explicit evidence inclusion and exclusion criteria before beginning the literature search. This will save you from having to review a lot of literature that doesn't really answer your questions, and will make your guideline development process more transparent and trustworthy. This has been a presentation by the Capacity Enhancement Program, sponsored by the Canadian Partnership Against Cancer.